Welcome to week 5 of clinical psychology. I'll be just sharing a few key points about this week's learning and work that's due. So, this week we will be delving even deeper into different types of psychotherapy interventions and their overarching paradigms. So, we'll be learning more about psychodynamic theory and interventions, cognitive theory and related interventions, as well as learning more about behavioral techniques and the origins of those techniques. We'll be learning a bit about the history, the original theorists that got these started and began developing research around these ideals, which has greatly provided a strong foundation and format of the types of interventions and therapeutic treatments that are offered today here in the States and across the globe. So I hope you enjoy this learning. It's definitely adding on to what we had started a little bit last week. Just as the last few weeks have been, you will have a discussion post and 2 assignments due. As usual, your original post is due Thursday night at midnight for the discussion board, and then I'm looking for you to respond to some of your peers by Saturday night at midnight. This week, we invite you to share an intervention, a therapy tool that you're going to research and provide some background on. You're going to give some information and summary of the purpose and objective of the use of this intervention tool in therapy, sort of the origins and background of it, basically some of the really key information you would like others to know. And what I love about this is we're sharing different ideas and perspectives and tools and hopefully gaining a little bit more of a repertoire of understanding of how many varying intervention tools there can be out there. I'd like for you to not only talk about sort of the background and the paradigm or kind of which theoretical orientation does this come from, but also the audience it's typically utilized for, or the mental health conditions, for example, and some specific recommendations that might help the implementation of the practice. So maybe 2 to 4 or so. And please try to integrate research for your discussion post here. It will really help serve your selling it and explaining the rationale for using it and using it appropriately. Then you have 2 assignments due this week. One is another visual aid or tool. It's not a paper, but rather a chronological roadmap of some of the history and information behind 4 of the main theoretical orientations we're learning about. Humanistic from last week or our prior week's learning, and then the 3 we're reading a chapter on each for this coming week: psychodynamic, cognitive, and behavioral. We'd like for you to think about which came first, what theorists and main clinicians or researchers sort of developed the ideals. What were some really important books or research or events that occurred around the time of the origins of these psychotherapy interventions, and do this visual aid of each of the 4, going into depth of summarizing them, coming up with different models and tenets of each, as well as about 5 to 10 noteworthy events that might be related to that. Again, it could be a piece of literature or something, or an actual event, to help better understand how this all came to be and how these really have provided such a strong foundation for our understanding of different psychotherapy interventions today. Have fun with this. Again, it's a visual aid tool. And for this one, I'd like for you to include references if possible. And again, always try to follow APA formatting, have some citations on the visual aid, and then a separate page for the references. For your second assignment due this week, you can do either a paper, or you can do a PowerPoint or Canvas presentation, but with voiceover. You don't need to include references or research for this second assignment, which is reviewing in depth, answering the questions posed here for one of the case study examples from week 3. So you get to choose out of these few cases that are listed in more depth at the bottom, and you're going to choose one to really focus on. In the questions listed, the 5 questions listed firstly, you are going to answer all of them from each of the 4 psychotherapies perspectives: psychodynamic, humanistic, behavioral, and cognitive, related to one of the case studies. And then putting that all together, I'd like for you to answer the next 5 questions from your own perspective. So what do you think might be the biggest underlying issue for this case example? What treatment interventions or assessments would you choose to use and why? Which one of these are you most aligned with? When would you know the patient has reached their goals or might be close to being ready to discharge, for example? So, after learning and applying the learning from this week to this case from all the different perspectives, you're then asked to kind of include your own input and your own ideas about what you think might be best suited for this individual and why. Take a stab at this. This is really exciting opportunity to practice deeper case conceptualization and treatment planning for a case study example, really applying the learning and interventions and to kind of back that up as best you can, thinking about the reasoning why you might start to tailor certain treatments or ideas for treatment for certain cases and why. Thank you so much for all your hard work so far. And I appreciate all the questions that have come throughout this course as well. Don't hesitate to reach out if there are any questions at all. I'm always happy to correspond with you. Again, either via email or if anyone would prefer a phone conversation or a Zoom meeting, I can always offer those as well. I hope you all enjoyed the week off, and I look forward to seeing your work this coming week. Take care, and we have only one more week left after this. This class is going by fast. Please try to stay on top of your work as best as you can as well. All right, take care. Happy reading and learning more about psychotherapy interventions.